Good morning mga kasambahay! This is Dr. Barba-Cabodil, your host at Doctors on TV. Bagong umaga, bagong kaalaman. Tara na mga kasambahay, ating ugaliing manood ng Doctors on TV. Dahil dito, tsak na kayo ay matututo ng mga impormasyong maaari ninyong bitbitin sa araw-araw at mabago ang ating lifestyle pag-usaping pangkalusugan. Before we proceed to our topic mga kasambahay, we would like to invite you to follow and subscribe our social media accounts. Please like and follow our Facebook page at www.facebook.com/doctorsontv and like and subscribe to our YouTube channel. Just type www.youtube.com/@UNTV News and Rescue. And you can actually send us questions and comments po sa mga pages na yan. Kaya after liking and subscribing, i-share nyo na din po sa inyong family and mga friends. During 1800s, noong pong madiskubre ang isang uri ng bacteria o viral infection na pangunahing apektado po ay ang ating mga utak at spinal cord, ito po ay ang sakit na meningitis. At makalipas po ang napakaraming taon, patuloy po na naitatala ang mga kaso ng sakit na ito maging sa ating bansa. At upang bigyan po kayo mga kasambahay ng brief introduction ukol sa sakit na ito, let's watch this.
According to the latest data published by the World Health Organization in 2020, meningitis deaths in the Philippines reached 1,041, or 0.15% of total deaths. Meningitis is a serious and potentially life-threatening infection that affects the protective membranes surrounding the brain and spinal cord. The age-adjusted meningitis death rate in the Philippines is 0.97 per 100,000 population, which ranks the country number 81 in the world. This means that while meningitis is a serious health concern in the Philippines, it is less prevalent than many other countries. Furthermore, it is important to note that meningitis can be prevented through vaccination. The WHO recommends that all children receive a vaccine against meningitis as part of a routine immunization schedule.
That is our dose of information for today. Kaya mga kasambahay, mahalaga po ay may kaalaman tayo sa mga sintomas ng meningitis na iisa-isahin po natin maya-maya po lamang. And for more details mga kasambahay, stay tuned. Doctors on TV will be right back. Welcome back, and now we'll be discussing meningitis in more detail. For our introduction, let's watch this and learn about what meningitis is.
Meningitis, an infection that causes inflammation of the protective membranes that surround the brain and spinal cord, which can be caused by bacteria, viruses, or other microorganisms. It can be a serious and potentially life-threatening condition that requires prompt medical attention.
We're excited to have a distinctive guest joining us today. We have invited a neurologist who focuses on mental and neurological disorders and its management. Let us welcome Dr. Perry Noble from Makati Medical Center. Good morning, Dr. Perry. Welcome to Doctors on TV.
Good morning, Sarah. Good morning, everyone. I'm glad to be here.
And thank you po at pinaunlakan niyo po kami ngayong araw. No? We're very honored to have you as our guest here today. And before we go any further, Doc, get ready to learn mga kasambahay. It's sure to be an enlightening and informative conversation that you won't want to miss. At the Doc, Okay, and to enlighten po us with this topic, Doc, Dr. Perry, can you explain what meningitis is?
Okay, we hear that commonly. As the term suggests, meningitis, I would always like to educate my patients, lay fora, when what we mean by meningitis, divide natin. Itis, usually you hear that, appendicitis, gingivitis, inflammation yun, pamamaga. So, ano ang namamaga? Yung first word, meninges. The meninges are the coverings of the brain and the spinal cord. So, any condition that is marked by inflammation or pamamaga ng covering ng brain and spinal cord is termed as meningitis. So it's quite a wide term. But generally, the most common type of meningitis is that of infectious. Ang cause ng inflammation ay may infection.
May infection. And if we say infection, that can be bacteria?
Yes,
or viral?
actually, there is a wide array of organisms that can cause meningitis. Sa ating setting, ang common TB, tuberculous meningitis. Then we have also bacterial, which is fairly common as well. Then we have fungal, no? Then we can have also viral meningitis, yung tinatawag nating aseptic type of meningitis, no?
I see. Okay. So ito na po ba yung tinatawag ng mga types of meningitis?
Yes, these are the types of meningitis. There is a small group that encompasses meningitis secondary to cancer, to trauma, but I feel for the conversation, we'll limit ourselves to the infectious type.
Infectious. Okay, so going back sa infectious meningitis, Doc, no? Okay, so you mentioned that can either be of bacterial, okay, viral, or fungal etiology. Okay, so but how does an individual get meningitis?
Okay, this is an infection. So how do you get an infection? So generally, ask yourself, how are you infected? Pareho rin sa meningitis. So this is mostly if you get the droplet or the secretion from the throat of someone who is infected. O kaya, sa closed living quarters or marami kayo, merong infected doon, maaari mong matransmit ito, no, for some reason, no? Yung umubo, nahawakan ng ang isang bagay, tapos ikaw rin nahawakan mo yun, o kaya nadaanan mo. So actually, just think, very common, we've learned about how COVID is transmitted. That's how meningitis can be transmitted.
Okay, and okay, having said that, ano po yung mga signs and symptoms that one patient who has meningitis manifests?
Okay, it is actually wide, no? Pero ang common is, of course, usually may fever, okay? But at times, maaring wala, no? Secondly, because of the inflammation of the meninges, naninigas yung leeg, no? Neck stiffening. Then, common is to have headaches, no? In some cases, because naapektuhan nga yung covering at saka yung blood vessels, pwedeng maapektuhan yung brain na rin enclosed. So you can have some behavioral changes, no? Nag-iiba ang nilagnat, tas nag-iba yung inaarte, as we say, no? We can suspect that. Then another thing is that patient may present with seizures dahil nga sa irritation ng brain, no? Then other manifestations can be actually even to the point that a patient with this can come with depressed sensorium, meaning tulog ng tulog, or akala mo natutulog lang, yung pala nasa ibang sensorial state na. We call it stupor or coma, no? So these are the states. At common din sa setting ng isang klaseng meningitis yung nanlalabo yung paningin, no?
Okay.
Dahil sa taas ng pressure sa brain. And because sa taas ng pressure sa brain, maaring magsuka or feeling na nasusuka siya, nausea and vomiting. So these are the more common features or symptoms of meningitis.
Okay, so ang dami yung na-mention, Doc. So for meningitis pala, there's really a wide range of signs and symptoms. Now, pero yung mga ibang na-mention natin, like for example, nilalagnat, alam natin marami namang pwede mag-present ng any infectious disease can present with fever, okay? Usually po, ano po yung presentation ng patient na clinically lang kung paano mo makita na kuha yung history and yung like simple history taking po sa pasyente na ito mukhang most likely this is meningitis.
Meningitis, okay. As I said, when they come to us, no, you would not entertain of meningitis if there's no telltale signs of infection, meaning fever, talagang fever. Tapos ang pangalawa is yung naninigas yung leeg.
Yan yung common.
At saka headache Yan ang pinaka-common. At tapos, pag sinasabi nilang nag-iiba yung ugali o nag-iiba yung kanyang alertness, yung parang iisipin mo baka meningitis ito.
I see.
Kasi pwede namang mangyari itong lahat ito na iba ang sakit, kunyari na intoxicate ng alcohol and everything. But the difference there is may fever.
Okay. So kaya
when
medyo
there's fever,
infectious.
we always should have a high index of suspicion that it may be an infection that affects your brain, the covering
I
of the
see.
brain.
Okay, and usually po yung mga ganitong presentation based po sa mga pasyente na mga na nakita nyo na, okay, who suffered from meningitis, ganong katagal po yung ganitong mga na-experience or nakikita sa pasyente before them being brought to the hospital and being seen by the doctors like you?
Actually, talagang wide range. Yung iba nga, akala nila, syempre, extended flu lang, akala nila gano'n. Yung pala, iba na.
I
Iba,
see.
So, what should suspect someone, no? Syempre, ang pinaka-suspicion doon, halimbawa kung number one, kung merong, halimbawa na nakuha ka sa history na may somehow na nakuha niya infection from someone else. So, you already suspect that it is a form of infection. But the thing is, the infection may have traveled to the brain. That's why it has caused the meningitis already. So, the incubation is actually different, no? From the time na nakuha mo yung organism, it averages 2 to 10 days. Range 2 to 10 days, but the average is about 4 days na makuha mo yung infection. So, depends on the state of the individual. We were talking a while ago, kung halimbawa, pagod ka, uyat ka, tapos ang dami mong ginagawa, ang dami mong iniisip, you're really prone to developing
bagsak ang
this.
immune system.
Yan nga, bagsak
Okay.
ang immune system.
So, does it suffice to say na, so incubation period will really differ?
Oh yes, it may.
Okay,
There's a wide range, no? So it depends, no? And some people may actually be carrying it without knowing they're just carriers, no? Okay?
Okay.
Ayan ang sad state because they go out in the open with transmitting the disease without
Okay, so kaya dadating usually medyo malala na.
Yeah.
Okay, so does it mean mahirap pong habulin pagka may meningitis, Doc?
Hindi naman, no? So halimbawa may suspicion ka na, we examine the patient. And as neurologists, medyo thorough. I don't know if nakapunta na po kayo ng isang neurologist, talagang tinitingnan po namin kung may parte ng brain or spinal cord or nerves natin apektado. And we can get this from the thorough neurological examination. If there's something suggestive of that, then, of course, wala nang dali-dali. Gumawa agad tayo ng measures in order to find out, to document or to support our diagnosis. And can I go through with that?
Yeah.
So, ang most common is, minsan hindi na tayo naghihintay. May mga klase ng meningitis na medyo, how do you call this, fatal, no? Kung naririnig nyo yung tinatawag nating meningococcal, no? Kasi pag yan, mabilis yan talaga, no? So, sa pag dumating na doon, nakita natin na may suggestion, kahit wala pang, may magbibigay na tayo ng sinatawag nating antibiotic. But, to confirm it is of course yung naririnig nyong kinukuhaan ng tubig sa likod.
Yung CSF po na
CSF
tinatawag.
analysis.
Okay.
That will definitely guide us. Why do we need to still do that? Because at times, with the culture and sensitivity, makikita natin, nagbigay nga tayo ng gamot, pero hindi pala sensitive doon sa binigay natin.
Yung nakita doon sa CSF, doon sa tubig po dito sa
sa
likod. Okay. And okay, na-mention nyo about doon sa CSF analysis po, yung i-culture siya, tapos and sensitivity test, okay, para kung saan sensitive po na gamot ang makikitang bacteria or virus or fungi, depende kung anong microorganism. Ano pa po yung ibang mga tests, okay, that can confirm our diagnosis na may meningitis nga po ang pasyente?
There are other things, like for example, the patient manifests already signs na nagke-headache, irritable, na medyo nagsusuka. So, we have to image, no, our brain, no, meaning CT scan or an MRI. Doon natin makikita itsura ng brain at saka yung covering niya kung merong signs suggestive of infection, no? And at times, lalo na kung medyo late na, makikita mo kung medyo yung daluyan ng tubig sa ating brain, yung tinatawag nating canal, no? Through which the ventricles ay lumalaki. Anong ibig sabihin yun? Maaring dapat mas agresibo tayo mag-manage ng patient. Okay? So, aside from imaging, of course, the lumbar tap, of course, we have to also determine what other illnesses the patient has, which may have somehow predisposed him or her to acquiring the illness. For example, fungal meningitis, that is quite common with immunocompromised patients. And you know very well na medyo common ang HIV sa atin.
Yeah.
So, in fact, in certain states, pag may ganitong type of meningitis, sometimes this is the leading diagnosis to the diagnosis of HIV. Hindi baliktad.
Baliktad
no?
na,
Oo.
okay.
So, in other words, lalo na yung those who are not treated with the proper medications.
Yeah, and of course, earlier na i-mention nyo po na very common, lalo na dito sa atin sa Pilipinas, yung TB meningitis. Okay, so syempre napakaraming may mga pulmonary tuberculosis. And in the event, and yung iba nga po kung wala pa sa later stage or yung more advanced na naghihemoptysis na lumulura ng dugo, dun palang medyo na-alarmang magpa-check up. And sometimes, minsan meron na pong nakakarating na ng mga meninges. Tama, Doc?
Yes. And in fact, I had the privilege, of course, to practice also in a general hospital. In a general hospital setting, mas madalas kaming nakakakita ng TB meningitis. Even in where I'm working right now in Makati Med, itong medyo common. No. So, in other words, talagang kailangan sama-sama yan, yung history, PE, neuro exam, and then all, we try to correlate and try to see which is the most apropos or apt diagnosis for our patient. Because our intervention will depend on, of course, what we get from the patient, meaning the microorganism.
Okay, since ito po yung nakita natin na setting dito sa Pilipinas, no? Okay, so can we say na meningitis is common or not really naman?
Well, in 100,000, there's but of course the statistics may not apply, but it's 5 out of 100,000 may have meningitis. In our country, it's still fairly common. Okay, if you go to the general hospitals, there is still quite common. Even in, because as we say, noon may expression nga, hindi ka Pilipino pag hindi ka may TB or somehow may exposure ka sa TB. So it's still, we still see them. It is something that I don't think it will stay with us for quite some time. So, and besides, as I told you, meningitis may not be just secondary to the TB or bacteria. It can be also caused by virus. And remember now, maraming lumalabas na virus and they can present themselves as meningitis as well.
And Doc, so is meningitis that very serious na talagang dapat matakot tayo?
Yes, of course, because of the complications that may arise. Which are actually number one, kasi nga nadali nga yung may pwedeng maapektuhan, magkaroon ng inflammation yung blood vessels, which we call vasculitis. Pag mangyari yan, pwedeng magkaroon ng bara yung mga blood vessels mo, magkaroon ng stroke yung pasyente. And of course, you know very well what the stroke manifestations are. It can be actually, hopefully, temporary, but some of them can be permanent and may impede the individual in his or her work, especially if she is working. Number two, you see children, lalo na pag pumunta ka sa malalaking hospital, nakikita mo yung nagka-infeksyon na malalaki ang ulo, hydrocephalus, no? So this
it depends
also,
kung anong age nagkaroon ng meningitis ang bata.
So yun ang isa ring complication, na kailangang lagyan ng tubo para ma-release yung pressure, tinatawag natin. And then the other thing is Dahil, like for example, TB, very notorious, and also sometimes some fungal, yung kanyang exudates ay nasa base ng brain, no? So, yung mga nerves natin na palabas, yung cranial nerves, na naapektuhan. So, maaring iwi, or kaya mahirap magsalita, or kaya naduduling, ganyan tinatawag nating cranial nerve palsies may ensue. And of course, the worst situation of it is, of course, if they do not respond to the medication, or if ever they do, but it was too late in initiation, of course, mag-spread yung infection, and of course, the patient would die.
Yeah, oo, na very sad, no? And, Doc, usually po, so, na-mention nyo kanina, it depends dun sa kung anong stage na nadala ang pasyente.
Oo.
But, can it still happen na parang kahit late na, advanced stage na nahahabol pa rin? And gano'ng katagal usually yung period of management para mahabol?
Being doctors, we always wish that we can do something for the patient. As long as it is readily available, we will try to do all means. But of course, as doctors, we are guided whether we can still help the patient. For example, may signs na somehow sumasagot pa yung pasyente, kahit papano gumagalaw pa and everything, then of course we do all means. But there are some patients who are brought to us really in a bad state na, and of course, alam mong kulang ang kanilang mga resources, nagdadalawang isip tayo. But ang mas importante is education natin sa pasyente and the relatives, and tell them of the condition, and then give them what is the ideal setup, and as much as possible, initiate them already.
I see. So, Doc, ito ba kung may meningitis ang isang individual, dapat ba matakot yung mga kasama? Kasi pwede bang mailipat, yung contact from
yan ang
person to
palaging
person?
kinakatakot natin. Not all forms of meningitis, no? Kasi syempre, nandudoon na sa meninges yun, no? However, there is a certain form, yung tinatawag na nabanggit ko kanina, meningococcal, kasi it's caused by a highly virulent, madaling ma-infect is yung meningococcal meningitis. Yun, medyo talagang dapat i-isolate mo yung pasyente.
So yan yung sa meningococcemia po, no, di ba, na etiology. Pero yan po, if I understand, if tama po, meron pong vaccine against that.
Yeah, there is a vaccine for that. Actually, it's suggested if ever you're, like for example, in a place highly, at saka kung halimbawa may nagkaroon ng meningococcal disease ang isang miyembro ng pamilya, din dapat lahat magkaroon ng vaccine.
I see. Okay.
But it may not be practical for everyone, at least those who were exposed.
Okay. Kasi po, ang akala kasi ng karamihan na ang meningitis ay pwedeng ang cause lang niya ay yung meningococcemia.
Hindi.
Okay,
so there is, I hope that we can say that there's also only one vaccine. In fact, from the other cause, yung Streptococcus pneumoniae, pneumococcal may another vaccine na naman doon, no?
Yeah,
so actually, depende sa situation, no? At usually ang infectious disease, there's a control, no? Will guide the community whether there's a necessity to vaccinate the individuals in that community.
Ay, sino ko, Doc? Umiinit itong ating talakayan, no? Ito, patikim pa lang to, mga kasambahay. Nako, pero maya-maya naman po ay pag-uusapan natin ng mga treatment options or preventive measures po para sa meningitis. Kaya stay tuned lamang, mga kasambahay. Doctors and TV will be right back. Sa pagpapatuloy naman po ng ating talakayan, kasama pa rin po natin si Dr. Perry Noble from Makati Medical Center. At ito nga, Doc, ang pag-uusapan naman natin ngayon ay yung mga treatment options po for the different types of meningitis. Okay, and ano po usually po ang definitely unang-unang kasama sa natin treatment plan pagka ang pasyente ay na-diagnose ng meningitis?
So, it's important to identify kung anong klaseng organism ang nag-cause ng meningitis. And then we appropriately give the proper antimicrobial. If it were a virus, then syempre antiviral. Kung bacteria, antibacterial. Kung TB, anti-tuberculous regimen.
Doc, teka, makat ko lang kayo, sorry. You mentioned about pagka-TB, anti-cox or yung anti-TB.
Anti-cox.
Kaya lang, di ba napakatagal gamutin ng ng TB, ilang buwan?
Wala tayong magagawa.
So, ganun din katagal yun?
Ganun katagal din yun.
I see.
And remember, pag secondary, non-pulmonary TB, we really sometimes extend. No?
So, that's even longer than 6 months?
Yes.
So, does it mean na ang pasyente naka-confine lang ng ganun katagal?
No. Ang kagandahan naman dito, sa nakikita ko, don't get me wrong, once ma-initiate natin, makikita mo pag nagre-respond sila, they don't need to be confined for a long time. And hindi na siya nakakahawa, as we say. No?
Yeah.
But you've seen a lot of patients na on anti-TB medications. If they do respond, hopefully they do, and they don't need to be confined. Ano bang reason for confinement lang? Siyempre, number one, kung debilitated ang individual, no? Meron siyang grabe ang symptoms ng headache, may lagnat pa siya. So, all of these things should make the doctor decide for the patient to stay. But if somehow care can be done at home, then we send
Pwede
the patient.
Naman siya. But what if in the event na hindi po infectious ang problem? Okay, infectious ang type of meningitis, it's the non-infectious type. How do you go about the management?
So, depends again kung anong cause ng non-infectious type.
Yeah.
No? For example, it's due to the trauma. So then, of course, try to determine how the trauma caused it. No?
Okay.
Like spread of a tumor, no, to the meninges.
Yeah.
You also term it as meningitis. No? So that's how we do it. No? So whatever the cause is, then we give the treatment appropriated to whatever cause it is.
Okay, but do we still give po mga antibiotic prophylaxis?
No, of course.
No need.
No. And unless, Kaya nga talagang magandang guide ang doing yung tinatawag nating CSF
analysis.
No?
Para mas guided,
no? Kasi may times, may nakikita tayo, for example, wala tayong na-yield, nakuha. Pero yet, the patient has fever and everything. May tawag tayong law, science of empirics. Kung ano sa tingin natin ang pinaka-probable na organismo, magbibigay tayo ng antimicrobial. I have to be honest, there are some cases na talagang hindi natin ma-decide and yet the patient is not improving. Yung tinatawag nating talagang parang 3-in-1 lahat bibigay natin.
We have to do something talaga nag-uumpisa na while waiting para lumabas yung mga ibang resulta. Kasi
alangan namang hihintayin pa natin kasi really, infection yan. No? And besides, as we always say, lahat ng mga pasyente natatakot, Dok, iba yung utak eh. Pag ma-remember, the brain, I always believe the brain is the center of most of our activities, like my talking to you, like my looking here at the camera. It is governed by the brain and my hand
everything
movement.
We do kasi, di ba?
So, if it is affected, wala na. Diba?
Okay, you mentioned about the brain. Kapag ba may meningitis, Doc, is there a chance of causing inflammation, pamamaga na rin sa brain?
Oh yes, of course.
Okay.
Oo, there's such a thing as meningoencephalitis, no? Ibig sabihin, pwedeng ma-capture or sa brain itself, no? Marami tayo, sometimes it's not really that limited. Hindi mo naman masasabi yung
hanggang dito lang.
Hanggang dito lang.
Okay. So, with that, having said that, talagang dapat mapigilan natin magkaroon, maiwasan natin magkaroon ng meningitis. And how can we do that? Ano po yung mga pwede natin i-share ng mga preventive measures on how one can avoid having meningitis?
You know what? In a way, COVID has given us a lot of education regarding prevention, and the same things that we know about COVID prevention will help us in preventing meningitis. What are these? For example, if you know a patient having had meningitis, and of course distancing. No? Number 2, of course, halimbawa, nasa isang school ka and everything, may suspicion na merong 3 o 4 nagkasakit, pinauwi and everything, then syempre, frequent washing of the hands, no? That's very
hygiene measures.
Hygiene measures talaga. And of course, some can be I still would advocate that if it is, for example, highly possible that in the household meron the use of masks, no, and everything. Something that we have been familiar with as a result of the pandemic that we
And of
have
course,
right
yung
now.
immune system, Doc,
Oo,
dapat
oo.
lagi talaga
And
our
yan,
immune defense is up.
You're saying about immune system. Siyempre, for those na we don't forget that we have to exercise, we have to eat the right food, and of course, sleep.
Oo,
Have
sleep,
adequate sleep.
napaka-importante.
Kasi bababa ang immune system mo eh.
Mhm.
So, may mga patients tayo na malakas nga and everything. Pero ito, hindi mga sinusunod. Tapos nagkasakit siya, magtataka siya kung bakit na gano'n. Kasi at one point in time, doon ka, magaling din ang organismo eh, doon ka aatakihin.
Yeah, oo. Kapag mataas ang immune system natin, kahit anong makuha natin, initially, pwede nang hindi mag-manifest sa atin
Right.
Okay, enough na yung ating mga immune cells para i-battle, hindi ka na nga aabot sa madadiagnose ka na may sakit ka pala, hindi ba, Doc?
Yes.
Okay, and Doc, eto, last, okay, sa mga nakita nyo sa mga may meningitis, yung parang in overall, doon sa lahat ng mga nakita nyo, should you say mas maraming nakasurvive na may mga meningitis rather than parang mas maraming complications po na nag-set in?
Okay. I'll go again with the statistics. Supposedly, overall rate of fatality with meningitis is high, about 21% if you get it. But in terms of, again, it depends on the care, how soon you see the patient, and of course, initiated the treatments, of course, the long-lasting effects, and of course, the condition, no? Kasi nga, ang problema rin, which somehow I would like to say, na it hits those who really are vulnerable. Yun nga, the elderly and the very young.
Very young ones.
So, remember, ang immune system nila medyo mahina na. So, those things govern the recovery of an individual. So, hindi pare-pareho. Pero I would like to say that somehow with I'm very being a doctor, I may say a scientist, an educator, and someone who keeps on learning about this, and thanks to the technology, the recent advances, medyo bumabawas na yung ating tinatawag na morbidity. That is how I feel, Don't, pakiramdam ko.
Hindi, I think, of course, you have like, may mga basis naman kayo
Kasi
dyan, Doc.
dati talaga medyo, pag may nakita mo, to be frank with you, I have even a cousin who was diagnosed to have meningitis before, but he had sequelae. He became deaf-mute and of course had seizures. But despite that, because nabigyan naman ng treatment, he's still up and about right now. Pero may deficits.
But at least he was able to survive,
Yeah.
no? We should always look at the brighter side naman eh.
Yes.
Oh yeah. So it depends nga sa company. Ako, mga kasambay, kaya ito dapat talaga kapag nakakita tayo ng mga kung ano-anong mga changes, okay? May ibang mga signs and symptoms po kahit kung di pa natin alam, kahit meningitis yan, maganda po dinadala natin kaagad sa
Pwede
doktor.
ko bang masabi?
Yeah, sure po. Go ahead.
Kasi di ba sa atin, being doctors, we have also this, parang yung pag may clustering ng symptoms, huwag ka na mag-iisa ibang isip. For me, really talagang isang red flag pag may lagnat na yan. No?
Yeah.
Pangalawa, pag medyo tutulog-tulog na o nag-iiba ang kilos o ganyan, sa tingin ko, yan yung time na maaring apektado ang brain natin. So that's why yung iba kasi, ay naku kasi dahil sa lagnat, ang taas-taas ng lagnat, kaya ganun ang manifestations.
May kanya-kanya kasi interpretation, iba. Kaya minsan nade-delay din po yung diagnosis.
We are surprised just to find out meron na palang form of infection, no? And pwede tayong mahuli. Okay? So, yun lang ang iniisip ko. So, even in the family, yun ang nais kong ipahiwatig na pag meron kayong kapamilya, anak, parents nyo na nilalagnat, tapos may iba pang on top of that, parang nag-iba yung kilos, tapos hindi rin magalaw ang isang parte ng katawan, most likely may infection yun. Ang infection doon hindi limitado sa
Kung ano yung
maaaring pumunta sa utak natin.
It could have started from the brain. Ako
Yeah.
dun may problema. Okay, so ang takeaway dito mga kasambahay, naku, kapag tayong minakitang makakaiba sa ating mga kapamilya, no, make sure po dalhin natin kaagad sa doktor. Mas maganda po yung guided tayo kaagad. Because alam natin, Doc, di ba, delaying the diagnosis would mean delaying the management. And ito, marami pong mga complications ang pwede mag-arise. Okay, and Doc, with that, baka meron kayong mga final words para sa ating mga viewers.
Well, I'm so happy to be part of to this session's interview. I'm always, this is part of my apostolate to always impart, no, ang expertise natin. Hopefully, naintindihan yung maayos. Kung merong katanungan po kayo, madali lang naman i-bring sa ating magandang host dito or na mapo-forward din sa amin. And besides, yun na nga, ang mahalaga is if this catches you, wag na kayo mag-iba-ibang isip, no? Wala namang mawawala. Well, of course, I have to be honest. Siyempre, iba iniisip yung expenses and everything. But however, hindi maibabalik ang buhay ng isang tao, no, kung wala na. Okay.
So thank you very much again, Dr. Perry Noble from Makati Medical Center. Napakarami po naming natutunan. Thank you very much. And before we continue our discussion, alam niyo ba mga kasambahay na maaari rin pong magkaroon ng meningitis sa mga bata sa edad po na 1 taong gulang pababa? Para po sa karagdagang impormasyon, let's watch Baby Talk.
Good morning mga kasangbahay! I am Dr. Katrina Florcos Dacanay, your pediatrician for today. Alam nyo ba na delikado ang meningitis sa mga bata at sanggol? Ito ay isang sakit na kailangan ng pansin at paalala. Dahil kabilang ang meningitis sa mga nangungunang sanhi ng sakit at kamatayan, lalo na sa mga batang wala pang 2 taong gulang. Kaya naman mahalaga malaman nating mga magulang ang ganitong sakit at kung paano ito may iwasan at magagamot. So let's start our discussion now. Ang meningitis ay isang bacterial or viral infection that causes the thin layers or yung membranes na nagsusurround sa brain at spinal cord to swell. The inflammation sometimes affects the brain itself. Ano nga ba ang main causes of meningitis in children? It is usually caused by a bacteria or a virus. It invades the cerebral spinal fluid. Ito yung fluid within the open spaces of the brain that protects and cushions the brain and spinal cord. Pwede din mag-cause ng meningitis ang fungus o kaya ang parasite. The symptoms of meningitis, iba-iba yan depending on what caused the infection and the age of your child. For infants less than 2 months, symptoms of meningitis can be very subtle or mahirap ma-detect. This can include fever, decreased appetite, irritability, or increased crying. If you see any unusual symptoms, kailangan talaga dalhin immediately sa inyong doktor for proper evaluation. The most common age of meningitis is 2 months hanggang 2 years old. So you have to watch out for symptoms tulad ng fever, vomiting, decreased appetite, irritability, excessive sleepiness, lalo nang bantayan natin kung may seizure at may rashes. Para naman sa older children, look for the mentioned symptoms. Plus, usually, they will complain of headache, pain in the back, a stiff neck, o kaya sensitivity sa ilaw. Now, if your doctor thinks your child has meningitis, they will likely order for a lumbar puncture or yung spinal tap to collect a sample of the spinal fluid. This test will help determine if the cause is a virus or bacteria. Treatment will depend on the cause of the infection. IV antibiotics will be given to treat bacterial meningitis. They might also give steroids to treat the swelling of the brain and meninges, IV fluids, and other medicines. There are several vaccines available to prevent some of the bacterial infections that can cause meningitis. This would include yung H. influenza type B vaccine, PCV13 pneumococcal vaccine, PPSV23 pneumococcal vaccine, at ang meningococcal vaccine. Vaccines that protect against viruses such as measles, mumps, chickenpox, and flu can also help prevent viral meningitis. And that's it mga kasangbahay. Sana marami kayong natutunan sa araw na ito. As always, please consult your pediatrician for your child's health. Salamat for watching today's episode. Again, I'm Dr. Katrina Florcos Dacanay. You can reach me through my Facebook page and YouTube channel, Dr. Katrina Flor Cruz. I also have my Instagram and TikTok, katrinamd.ph. See you in our next episode.
Thank you, Dr. Katrina Flor Cruz Dacanay, for giving us an information about a serious health condition that can affect young children. I hope mga kasambahay ay nakatulong po ito sa inyo. Magsilbing gabay po sa atin ito, lalo na't sa kapakanan po ng ating mga anak. Let us help ensure that our children grow up healthily and happily. Mga kasambahay, we hope that you found our discussion on meningitis very informative and helpful. Lagi pong tandaan na ang meningitis po ay isang serious health condition. Dahil pag ito po ay hindi naagapan ng maaga ay maaari pong magkaroon ng panibagong health outcome. Don't hesitate to seek medical attention right away. But before the final goodbye, let's just pause for a short break. Doctors on TV will be right back. Back mga kasambahay, and of course, gusto ko sabihin hi to Iyo, Iya, and EJ, and of course, hi kay Dr. Alain Barba-Cabodil, and syempre sa mga pasyente natin sa Klinika Figura. And of course, Nanay and Tatay, I love and miss you both. Mga kasambahay, that's all the time we have for today's episode. Thank you po for tuning in and hoping to see you all again next week, God willing. Muli po, maraming salamat po sa inyong lahat. Ito po si Dr. Sara Barba-Cabodil. Let's make it a habit to learn about good health. Only here at Doctors on TV.
We would like to thank Makati Medical Center, a hospital with a heart, located at Amarsolo Street, Legazpi Village, Makati City. You may contact them at 632-8888-8999. Like and follow their Facebook page at I Am Makati Med, or you can visit their website at www.makatimed.net.ph. Makati Med Wellness Center, located at 7th floor Ayala North Exchange Tower 1, Legazpi Village, Makati City. Mestiza soaps. Mestiza soaps are made with natural ingredients and a combination of vegetable and fruit extracts, which can be also used by children and pregnant women. Good news is that these beauty products are vegan and cruelty-free. For inquiries and orders, contact 0969-175-4231-33 or 02-8824-5217 or 02-881-30320. Organic Acai. Support your health with 100% organic superfood supplement, Organic Acai Premium Blend, and Acai freeze-dried capsules. Rich in powerful antioxidants, fiber, amino acids, vitamin C, omega fats, and other essential nutrients the body needs to help build stronger immunity against illnesses and help increase your energy. Organic Acai is available in all Mercury drugstores and other leading drugstores and supermarkets nationwide. Linden Gas Corporation, located at 179 National Road, Landayan, San Pedro, Laguna, 4023. For inquiries, you may contact them at 02-8824-0867 or 02-824-9360, or you can email them at lgcsalesco@gmail.com. And of course, salamat sa ating partner, ang DepEd Santa Rosa, sa pakikiisa sa ating adhikain na maibahagi ang kaalamang pangkalusugan. Klinika Figura. You may contact them at 0917-317-7272. Medical Depot. Healthy Nom Nom Food. Barba-Cabodil Holistic Health Group, located at Unit 1531, Centurion Medical Makati, Century City, Makati. You may contact 0917-317-7272 for appointments and other inquiries about your health and wellness needs. Please like and follow Facebook page, Dr. Sara Barba-Cabodil. Special thanks to Dr. Gia Grace B. Sison, Head of Makati Med Wellness Center. Attorney Pilar Nenuga P. Almira, President and CEO. Dr. Saturnino P. Javier, Medical Director. Ms. Arlene L. Sonco, Senior Vice President. Ms. Monica Reyes Dizon, Assistant Vice President. Mr. Mark Funelas, Unit Head Manager, Communications and Special Projects.